published never existed. So if we want this webinar to exist and all this communication to exist, we must publish that. Okay, we must make a publication. So the proposal is to make out of the webinar from last time 7 and 8 and the plenary sessions of this webinar to make a white paper on the global health, One Health. And for the specific sessions, so pollution, AMR, vector-borne disease, and zoonotic pathogens, for this three type of session, to make each type a collective paper, review or concept, I'm not sure, a collective publication to be submitted to address, of course, the main problems, and to be submitted for publication to review. To me, and I take advantage of the presence of Pierre, the obvious journal to submit something could be environmental research. I don't know what you think, Pierre.
Yes, for sure. We have some section related to epidemiology and environmental health in general.
Yes.
So I cannot handle the manuscript, but you can submit.
You can be co-author.
If I'm a co-author, I cannot handle. But
no, you cannot handle. Of course not. No, you'll be co-author. You cannot handle.
Okay. But you can submit. Yes.
I'm not sure whether it should be a review or a concept, a paper. I'm not sure.
But another journal could be Global Challenges. It's a good journal, and impact factor around 6 is a good one.
Pretty
so
close. Okay.
In case.
Yeah. So anyway, the idea is that one is out of everything that is going to be said today and tomorrow, to make some collective publication out of it. That is my proposal. Tell me what you think, if you agree with that or not. And so that was my introduction. So again, thank you for participating. So Pierre, since you are on screen and you are the first one to talk,
okay,
I give you the floor. The floor is yours. Please, we follow your presentation.
Okay, so can you see the full screen?
Yes.
Okay, so now I will give a talk about the effects of tree canopy cover on air pollution, but also on air pollution related death in European cities. So as you know, air pollution has many adverse effects. So in particular on materials, buildings, on human health, in particular leading to respiratory and cardiovascular disease, but also on biodiversity, with a significant decline of biodiversity, in particular in urban centers, and on vegetation, on forest ecosystems, with discoloration, with defoliation, and also with specific symptoms due to air pollution, in particular tropospheric ozone, with the occurrence of chlorotic mottles at needles or leaves surface. So air pollution, ambient air pollution, led to almost 4 million of premature deaths worldwide in 2019, and almost 7 million of deaths are expected by 2050. In cities, citizens are exposed to more than 200 classes of air pollutants. And the most harmful air pollutants are tropospheric ozone, fine particles, and nitrogen dioxide, NO2. with most harmful for human health, but also for ecosystems and biodiversity in general. And billions of people are exposed to level of PM2.5, ozone, and NO2 above the World Health Organization air quality guidelines for human health protection. In 2022, 73% of the European population lived in urban centers, leading to a total of 500,000 of deaths due to air pollution, but also due to heat excess. As you know, urban trees can provide many social and environmental benefits, like the reduction of air pollution, the mitigation of urban heat island, but also for biodiversity conservation and recreational and aesthetic benefits, all of them leading to citizen well-being. This is why efforts for optimizing urban greenness are urgently needed in cities. And the European Commission launched different directives, for instance, the biodiversity strategy by 2030 and the nature restoration law in order to increase to develop ambitious urban greening strategies and to plant additional trees, in particular in cities. So in order to investigate the effects of tree canopy cover on mortality due to air pollution, we estimate, first we estimate the changes in a tree canopy cover over the past 20 years in the 744 urban centers with more than 50,000 inhabitants in European countries, so 36 European countries. And we conduct a quantitative health impact assessment in order to estimate the effect of tree canopy cover on air pollution and related mortality in each city in Europe. So for that, first we define urban center. So the urban center was defined using the global human statement layer with, so we defined each grid cell as urban center depends on a density with more than 1,500 people per grid cell, the quantity of grid cell, but also the total population over 50,000 inhabitants. So for the population distribution, we use the World Pop dataset. For the air quality dataset, we use a combined dataset with satellite observation, data from chemical transport model, and ground-based observation from the air quality monitoring station. Regarding the tree canopy cover, so we use the Landsat-derived tree canopy height change and a global forest canopy height dataset provided by the University of Maryland in the US, providing early estimate of canopy height at almost 30 meters of spatial resolution. So the tree canopy cover is defined per pixel, like the surface covered by branches, stems, and leaves. Also, we adjust the minimum tree height from 5 to 3 meters. So we select only the trees above 3 meters tall in order to include the non-native and ornamental tree species omnipresent in urban centers. So all 30-meter pixel estimates were aggregated for each urban center. For the air pollution-related premature mortality, so we use the health impact function established by the World Health Organization, and we calculate the population attributed fraction for each grid cell. So using the relative risk value derived from the World Health Organization meta-analysis for a given mortality, for all causes mortality, and for a given air pollutants. So we estimate the number of deaths due to PM2.5, ozone, and NO2 within each 1 kilometer grid cell. And at the end, we aggregate all values in order to obtain the total number of deaths for each urban center and each year. Regarding the trend analysis, so we apply the non-parametric mean candle test and the sense slope estimator in order to detect trends within a time series and to estimate the magnitude of the trend. In fine, we apply the linear mixed effect model, so in order to estimate the effect of the tree cover on air quality and mortality. So in this model, we select the city and here as a random effect, and the tree cover as a fixed effect. So in order to account for the intrinsic differences in air pollution among cities, to take into account the difference in population, the number of vehicles, the climate, etc. And also over time, in order to take into account the reduction due to strategy for the emission reduction. So we obtain high variance explained by the model, so more than 85%. And we did all analyses at the citywide scale over the time period 2000 to 2019. So quickly, I can show you the trends in air pollution, in this case for the PM2 mean concentration over the time period 2000 to 2019. So we observe a decline of PM2.5 levels in cities by almost 1% per year. And also for NO2, so we observe a decline of NO2 mean concentration in cities by almost 1.2% per year. For ozone, we use the summer mean daily 8-hour maximum ozone concentration, widely used for epidemiological studies. And we observe an increase of ozone mean concentration in cities on average 0.6% per year due to lower ozone titration due to the reduction of NOx emission, mainly by car, and also due to the decline of PM2.5. But we observe a decrease of ozone maximum values, in particular in summer, due to the reduction of precursor emission. So we observe a decline of max ozone values almost 0.3% per year. After that, we calculate the attributable death due to each air pollutant. So in this case, NO2, the attributable proportion of death due to PM2.5 and due to tropospheric ozone. And at the end, we sum and we obtain the number, the percentage of death due to air pollutants. So in this case, the sum of NO2, PM2.5, and ozone. In Poland, it's almost 17% of death due to the air pollution. Inversely, in Ireland, so we observe almost 4% of mortality due to air pollution. So now I can show you the trends in urban tree canopy cover. So on average, the tree canopy cover is around 19% over the time period in the European countries. The maximum, the highest proportion of tree cover was observed in Finland with more than 36%, Switzerland with 30%, and in Belgium with around 26% of tree canopy cover. Inversely, the lowest proportion of urban tree cover was observed in Malta, around and Kosovo, with around 3% of tree canopy cover, and Romania with 5% of tree canopy cover on average in each city. So at European scale, the tree canopy cover increased between 2000 and 2019 by almost 0.22% per year, with a decline in Northern Europe, in particular in Finland, and a significant increase of the tree canopy cover in Romania, for instance, almost plus 1.9% per year. So the linear mixed model, so we calculate for each 5% points increase in tree canopy cover would reduce by 1.2% the summertime ozone maximum daily average of ozone concentration, and by 2.8% and 1.4% the annual concentration of PM2.5 and NO2 in European urban center. So after that, so we calculate different scenarios. For instance, if in each city we increase the tree canopy cover from the current situation to the 30% of tree canopy cover. So if in each city we increase the tree canopy cover from the current situation to 30% of tree canopy cover, we would reduce by almost 10 deaths per 100,000 people, with a lower number of prevented deaths in Western and Northern Europe, and the highest number of prevented deaths in Eastern Europe and former Yugoslavia. We also calculate the number of deaths if in the scenario, no tree scenario. So if we cut all trees in each city, so we have an increase of the number of deaths due to air pollution by more than 8 deaths per 100,000 people, with high increase in Eastern Europe, in particular in Poland and Slovakia. We observe a significant increase of death due to air pollution. So compared to the situation, the tree cover in 2019, so each 5% point increase in tree canopy for each urban center would reduce by almost 4% the number of deaths due to the air pollution annually, more or less 5,000 deaths in Europe. So in this table, so I show you the total number of cases for the current situation, so 2019 before COVID. The number of cases due to number of deaths due to air pollution, and for both scenarios. So for the second column is by reaching the tree canopy cover of 30%, and we calculate the difference between the tree canopy cover 2019 and the tree canopy cover 30%. So the difference of death. And for the last column is in the no tree scenario. So in all urban centers with more than 50,000 inhabitants, increasing the tree canopy cover from the current situation to 30% could prevent almost 12,000 deaths each year. And if we remove our trees, so we had 25,000 deaths each year due to air pollution. So in conclusion, so between 2000 and 2019, the mean tree canopy cover was around 19% in all urban centers in Europe. So the tree canopy cover increased by 0.8 percentage point between 2000 and 2019, with almost 74% of cities showing a greener coverage. In 2019, so about 25% of the total population in Europe lived in cities with more than with a tree cover over 30%. Each 5% point increase in tree canopy cover decreased by almost 3% the annual PM2.5 mean concentration, 1.4% the NO2 mean concentration, and by 1.2% for the maximum ozone concentration. If we increase each 5% increase of tree canopy could prevent about 5,000 deaths annually due to air pollution. And reaching a tree canopy cover of 30% in each city could prevent almost 12,000 deaths annually. However, reaching a tree canopy cover of 30% is very challenging, even unattainable, in particular in densely populated cities facing water scarcity. So now we are moving from 30% of tree canopy to 30% of vegetation cover in order to develop ambitious urban greening strategies. And also very important, so peri-urban areas could be target for greening strategy because some modeling studies show that planting trees in urban area have a significant impacts on air pollution in cities, but also on air temperature. Thank you so much.
Thank you very much, Pierre, for a very, very, very interesting presentation. I know you have to go for another meeting. Do we have time for one question, and a quick one?
Yeah, yes, in case I can come back.
No, just a very quick question,
no
very
problem.
simple. You show clearly an improvement when there is more canopy, so more green, okay? My question is very simple. Is it a direct effect of the canopy itself, I mean the percentage of coverage, or is there any indirect effect because the cities where they plant a lot of trees also have other actions like more pedestrian area, bicycle, less cars, etc., 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 that will reduce the pollution, but not directly through the plantation of trees?
It's an indirect effect, and you know, it depends also the tree species, because some tree species can degrade air quality, because some tree species can emit VOx, like isoprene monoterpene, leading to the formation of ozone. So, if you, we need to plant very carefully, so by selecting efficient tree species. So for sure, we have an indirect effect on air quality. Also because you have less traffic, so less NOx emission.
Okay.
If you come back, I have also question, but now.
But maybe you can ask me now in case.
We can write the question down, and when you come back, we jump on you.
Okay.
In some way, we are late, so thank you.
No problem. Thank you very much, Pierre.
See you.
Thanks a lot.
Thanks.
So I need to find out the program.
It's me. It's
you?
Me.
Good. Thank you.
And I
next one is Professor Isabella Annesi-Maesano, who is going to talk about another kind of pollution.
Yeah, do you see my screen?
Yes.
Now?
Now?
Yeah.
No.
Yeah.
No,
No?
not now. No.
And now?
No.
But
I see the. Oh, yes. Now, yes.
it's slow.
Yeah.
Anyway, there was the template, as you had indicated. And now, okay, we go on.
It's gone. Okay, go ahead.
Thank you so much.
The floor is yours, Isabella.
Thank you. Thank you so much for inviting me to talk about this important issue that is the exposome in the One Health approach. I have, you see it still, yeah? You see again? Roger?
Yes, I see.
Okay, so thank you. Just to know whether it was working. Now I don't bother you anymore. I have some conflict of interest, but they
Sorry,
are...
I was answering, but my microphone was off. Sorry.
No,
So
no
yes,
problem.
yes, it works.
Okay, thank you. Just to check. So
Sorry.
I have some conflict of interest, but in public institution and or medical society, international. And what I want to underline is the last line, because we were talking where we can publish a white paper, an overview, or something like that. And I'm a section editor of two important journals. If we target respiratory health, we can also publish there. That is an invitation. So let's start by the exposome. What is it? In analogy with the genome, which is the totality of the genes we, the human beings, have, the exposome is the totality of environmental history. So it can be seen just like a history, a book filled of information of a person in his entire life. When I say entire life, I mean also what happened during in utero life and in preconception, even because of epigenetics. That exposure that can influence the state of health. I'm biased because I'm in allergic respiratory diseases, so I'm showing here the exposome involvement in allergy, but as you can imagine, exposome is used in many diseases, communicable or non-communicable, and the concept was elaborated by Professor Wild in IARC, International Agency Research Council, because to explain why cancer prevalence, the frequency of this pathology was increasing so much. He said genes are important, but certainly cancer is an environmental disease, and so we need to take into account that several environmental factors can be involved in its development. So he suggested that we can consider that there are three types of exposome. The first is the specific external environment to which the individual is directly exposed. You have some example here: in utero smoking, biocontaminants, pollutants, diet, consumer products, etc. And then there are the risk factors that are not really specific to the individual. They are indirectly specific because they belong to the environment where the individual lives. So this means that sometimes it's not really directly exposed, but indirectly. These are the climate, the external biodiversity, of which we heard now, urban environment, but very up-to-date social networks and material. This is the external exposome. And this external exposome obviously impacted our body and leaving signals, biological signals that we call the internal exposome, that are assessed using omics. You have some example here of omics, transcriptomics, adductomics, metabolomics, proteomics, etc. These, in my experience, are very interesting, but not so much informative. Sometimes you find things that you cannot explain, and in addition, very expensive. The other way of the external exposome to impact an individual is through what is called the gene-environment interaction. So the genome encountered the environment because of some individual susceptibility. There is a special reaction. And also, and I said you, through the epigenome, we know now that many environmental factors impact the epigenome. This means the methylation. And when the methylation do not work, the genome act differently. So in doing the exposome, you saw the list was very long, but it's not long enough because we know that almost 50% of the risk factors for non-communicable communicable diseases are unknown. Okay, so this means that it's problematic. We need really to work a lot. The second problem with the exposure is that when we try to assess them, we have to take in mind their complexity. I give you an example here. Think about the lead. Lead can be found in air, water, soil, food, etc. So if you want to assess how much lead is penetrating in an individual, you have to take into account all the sources. These obviously penetration depends also on the kind of place, home, school, work, etc. The period of life, because in epidemiology we talk about windows of exposure according to the susceptibility of the people, the impact of a contaminant, pollutant, etc. varies. And then there is also the difference in the route of a contact. Being penetrated through the skin is different than being penetrated through the inhalation itself. And then there is also the phenomenon organ distribution tag. So this means that we need to do the exposome to take into account of this complexity. You have recognized, I think, Homo sapiens connected by Leonardo da Vinci, saying in one wonderful drawing that there is this complexity. And so here you have some example, but I will more detail very soon on the technologies that can be applied to assess the external, and also I'm not going to talk so much about the internal exposome over the course of life. For the external, I will show to you there are chemical sensors, smart device, big public data, imaging, exposure modeling, and Pierre already showed what he could do for canopy and for air pollution. And then for the internal, I told you already about the omics. And what is needed is to go towards the ideal, to exposome profile that can be put in link with the diseases. And then taking, as I told you, take into account the multiple source, the multiple routes, the real time, etc. And this means as many assessments as possible, but at least a crucial stage of life. Because, you know, I said all the life, but this is not feasible. So we in Exposomic have defined 8 crucial stages of a life that are informative. And now, So here you have some example used of this assessment in my epidemiology. I since ever use survey questionnaires that are very now validated, very well validated about smoking, occupation, etc., etc. Then more up to date to know, I can know the composition of a product simply scanning a barcode, which is important. Then, as I said by Pierre, we can use remote sensing through the satellite network monitoring. We can also use app giving us smartphone, smartwatches, the results. And then we can wear sensor, and I'm going to show to you a sensor we have done recently. But this can start from open access data. This is our paper last year showing, you have here the list, all the information, a data set we could define for social demographic, meteorological data, chemical pollution, etc., 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 even using the satellite, Copernicus, etc. So this means that at zero cost, you can have information on the exposome. Obviously, as Pierre well said, then there is the problem of the resolution. So which resolution is available? 1 kilometer. He went very low with the canopy, 30 meters. That's means that from the open access data, you get data on which you have to work hardly. But this, I'm very happy to know that, to say also to the community that this data open access are available. This is another kind of assessment of the exposome I made once. It's first and last time probably, because this, what you see on the right is one person, an elderly, no, it's a woman aged 25 minutes, and using available sources of air pollution plus her personal information and modeling, we could assess lifetime of environmental exposure of this person. This was done in the ILS project, of which I was a DPI, a European project. And as you can see, for example, the first slot, these are electromagnetic wave. When she was born, 35, no waves at all, and now there are many. So the same for lead here, mercury in the teeth existing when she was young and no more there. So this is another way. And the third is this small sensor that you carry with you. Here you have two kinds. This is a volunteer going with this sensor. Here you have the in red or brown according to exposure, the microgram per cubic meter fine particulate matter. You can see that this guy here, you know, inside this circle was exposed between 150 and 500. For the WHO, we have to stay at 5. So there is obviously an exaggerated pollution for this period. And the second color say where he was when he was exposed. So this is the best way, obviously, to assess pollution, because in real time, indoors, outdoors, you have the assessment. One, you have this data. After the data acquisition, you obviously you have to process them to reach, and then you move to data analysis and delivery with what Pierre showed the health risk assessment. In his case, this was the population attribute fraction, but it's exactly the same, and or some integrated quality map and model. And the idea is, I'm in public health, to go towards, as I said, the smart application, public access for everyone, because the people that suffer from respiratory disease really need to be in touch with to be informed about air pollution, and obviously professional physician, etc. So just one example of exposomic factors, and this is my field. I'm going to talk about air pollution, pollen, climate change in the context of One Health, because this is the issue here. So let me start by Pando. I don't know if you are familiar with this guy. This is not a dog. This is this wonderful tree. We were talking about a canopy. So from one clone, there are now 47,000 clones that grow from the spread of the roots mainly. This is the largest, the heaviest, the oldest tree in the planet. And because of 80,000 years, Pando has lived quite a bit, and as is really for us the voice of the observer, the best observer of the climate change. And what Pando saw is that since the 18th, there was an increase in temperature. You have here what is really characteristic of climate change is the variation in precipitation and also in temperature. This paper I had really suggest that you can read. It's very interesting because it put a link between climate changes and the historical important events like the Roman Empire, for example. And then, okay, in the 80s, the temperature started to increase, but particularly since the 2000, but even a little bit more the last 20 years. I'm going very fast. We are responsible of the production of greenhouse gases that are at the origin of the increase of this temperature, of the modification of the water cycle through melting snow, ice, rising sea. And also this is at the origin of increased intensity and frequency of extreme climatic phenomena, heat waves, drought, flood, cyclones. And which are the consequences? This is really very French to say that since 2018 we are observing an increase in temperature, which is very important, but the GEC has just published its last report, and these say that extreme heat times 4 has been observed since the 1990s. France is among the most affected countries, and there are 62,000 deaths in Europe in 2024 that are due to climate change. But climate change is responsible not only for direct impact through climatic variables, but also for indirect impact through the increase of the risk factors that are responsible for many diseases. And in my case, what I'm interested are air quality and ecosystem change, and namely the biodiversity in terms of pollen, moths, etc. You see here the most famous impacts, but I want to underline also, we don't have a time, but that groups at risk are really to be taken into account when making prevention. This depends on age, this depends on health status, and also on in some way particular population like rural community, migrants, or etc. So in the context of One Health, it's important to see that the climate change is really impacting pollen and pollution. There is a convergence of evidence on it. There, we observe a joint temporal gradients of both pollen and pollution. We observe increased exposure. We observe emergence of interaction between pollen and pollutants, and this is really important, and amplified health impacts. So the time gradient very quickly. Pollen, since due to climate changes, has a disrupted calendar, lengthening anticipation of the season of pollen, increase in pollen quantity, increase in pollen allergenicity, and geographical expansion of health. And on the side of air pollution, this is in augmentation, even if Pierre was saying that there is a 1% diminution in his, because it was considering globally, and this was one of my questions. When you go into detail, you don't see all the time this diminution. In any case, is a quantitative, a qualitative increase. There is a shifting of the seasonal peaks of ozone, for example, evolution of air chemistry, new climate pollutants, mega firestorm, and emerging pollutants. So that's for pollen. See, the upper part show the chart for the pollens. In 1 week, the red part is with a lot of pollen. Last year, in 1 week, France was had observed an invasion of a very many pollens. And now, on the low part of this the slide, you have one tree, I don't know the name, Etre in English, I can check in my mind, I knew. And in 127 years, this plant tree, because of the more favorable climate, will go towards Paris. That's a more scientific paper showing Lancet respiratory medicine, saying that temperature lengthen the season and the abundance of pollen, and also the load of the allergen, because you know we are not allergic to pollen, we are allergic to the allergens that contain inside. And another effect of pollution is that CO encourage the plant to pollinate more, and with, on the right, more allergen inside. These are results from the NASA, because they went in the space with plants, and these plants were pollinating more, and they were more allergenic. For the population, what we know is that we have more outdoor ozone. Pierre talked about that due to urbanization, stagnant condition, when air condition, when it's warm. But what we know less is that we have a more particulate matter, higher level, I want to say, because of also still because of urbanization, but also because of all these phenomena, natural phenomena you see here: desertification, sandstorm, wildfire, and obviously this makes a lot of PM circulating in the air. And there are also, this was said by Pierre, some forests are releasing some pollutants like, but I forgot the line, like volatile organic compounds. And another phenomenon is the evolutionary chemistry. You have a London, not in 52, sorry, 25, in the past, in 1952, noon, light on because of the smog. The same in Bombay every year. This is a picture I took when I was there, but it's true every year. This is the old pollution with dioxide, sulfur dioxide, big particles. But on the right, even this year, 2 weeks ago, I think, if I'm not wrong, or 10 days ago, this is, you see, the layer of pollution visible. This is done by what we call the ultrafine particles that are in the atmosphere when there is the inversion of a temperature. So some in Mars, in general, in Paris. And last but not least, I need to talk about the emerging pollutants. Since the 1960s, the men produced 350,000 new products, ex novo. They are everyday products. You see plastics, PFAS, pesticides, phthalate. You see the sources, and then you have the exposure pathway here in the last line. The air we inhale, the food we eat, the water we drink, and unfortunately that we use for example, beauty, for maquillage. And so it has to be known, are persistent, bioaccumulative, and not without consequence. Many are cancerogenic. And unfortunately, they have been produced without any control. The European Commission now has the knowledge on 30,000 products. Otherwise, they are used without any control. When there is an alert, then there is a formal check. But we are very far from the 350,000 products I was talking about. So, and then I want to talk about some new mechanisms that are to be taken into account in this One Health impact. The pollens, other proteins are more aggressive. Still in the field of pollen, the temperature stress the plant that produce more allergenic proteins. The name is PR, pathogenesis-related pollen. And the second phenomenon is the one of the super pollen, the results of the meeting between pollen and air pollution, which is also called the pollen. Here on the left, you have a normal pollen exposed, when exposed to pollutants, it can be either a vector for a pollutant or the second figures here can be damaged by the pollutants, and I will show to you some figures, or can be fragmented. And as a result, the pollen that in general are large and stop at the level of the nose go inside towards the bronchi and the lungs. And there is also an associated increased allergenity because the fragmentation and the liberation of the particle inside is bad. And this is the origin of asthma attacks. Here you have the picture. In pink, you have a pollen carrying some particles. But here on the low part, you have pollen modified by a spray of a pollutant. So you can see, you see the small particles, they are really bad for our lungs. This is why pollen-related asthma is increasing. And there is also fatal synchronization, overlapping between pollen and pollution gradients. When there is a pollution, now there are the pollens, which is not good. And also the summer is extended so that the grass herbaceous pollen season stretch out and meets the summer ozone peaks. In medicine, we say where 50 years ago the allergic person had the periods of respite, of resting, the time gradient show almost continuous exposure to an irritating allergic mixture from March to October. So people are very tired, even if rhinitis is not dangerous, they have bad quality of life, they don't sleep, etc. So the first reason for that, and I would have had Pierre here to understand that, but I know that Roger is very strong in it, is that all the risk factors I was talking about, they impact the barrier. We have many barriers as a defense of our body. We have the respiratory barriers, we have the skin barriers, we have the ocular barrier, the gut barrier. On the left, you have an intact barrier that works well. Everything goes the right direction and the immune system works. On the right, we have an impaired barrier because of pollens, because of pollution, for example. And then we have the enemy that can penetrate more. And this is the origin of inflammation, Th2 sensitization. This is really an allergic issue, but in any case, we have oxidative stress, mitochondrial damage, pro-inflammatory cell activation, and so what I wrote there, leaky lung, leaky skin, and many diseases. And here is the case of asthma. So we have all the factors of that are considering in One Health approach, the temperature, the humidity, precipitation, air pollution, natural anthropogenic, and pollen that are at the origin of either exacerbation of a disease or clearly the onset of the disease. This is a little bit complicated, but is like Pierre showed, this is a model. Each column are the month of the year. There are 12 sections, sorry, one per month. So Monday, January, the first, the last is December. You have the cluster according to the characteristic of the risk factor you have presented up to now, including the land cover, whether this is agricultural, whether this is forest, etc. And the cluster 5 is in blue. And what we saw, take into account the sales of asthma drugs, that it was in the presence of pollen, elevated pollen concentration, that we had more sales. So I'm almost finishing, and I know I have some minutes of, I'm late some minutes, so to say that we have to integrate the exposome with this the One Health perspective, as I show here with these slides, and obviously I have put what for me are the most important risk factors, not only for the human beings, but also for the animal and the ecological system. On the right, you have a potential diseases solely. And we need a comprehensive assessment, synergies and dynamic feedbacks between environmental factors that should lead to cumulative risk for all living systems. And the exposome is at the basis of that. So just because I know that Roger is an infection interested person, my review at the beginning on COVID and air pollution, because they are related too. We can discuss that. So we know now that air pollution is bad for infection. And so I finish to saying, what do you go about it? Do we go, I should have said, by easier than said than done. And here there is an individual centering mitigation framework for climate-driven risk factors, which is, I think, good for One Health in general: reduce carbon, sustainable consumption, advocacy, monitor your exposure, increase indoor air quality, and the use of personal barriers like a mask and glasses for pollen. Glasses work, for example. Key message: 2. Exposome research serve as the operational bridge for the One Health approach, shifting the focus from isolated pollutants to the cumulative and lifelong chemical environmental pressure shared by humans, animal ecosystem. This dimension of a continuous exposure, it's really important to be taken to account. By mapping the totality of exposure from climate change and biodiversity loss to synthetic chemicals, have you seen that there are many products that are nasty and bad for us? Exposome science provides the holistic data needed to protect global health at its environmental source. And I thank you.
Thank you very much, Isabella. Thank you very much. We have, unless there are some quick questions now, we have the round table at the end.
Yeah, no, I stay to listen.
Okay, very good.
To
Very
the
good.
other.
Okay, so thank you very much. Now we are moving to the next presentation, which is...
Do you see my presentation?
Yes, yes. Thank you.
Okay, and now in full,
Yeah,
in full
perfect.
screen? Perfect. And do you understand me?
Yeah, we listen to you very well.
Okay,
Everything
thank
is
you so
perfect.
much.
Everything is absolutely perfect.
Thank you so much for inviting me. My name is Marilia Souza. I'm from Brazil, and I'm a teacher and researcher at University of São Paulo, at the School of Pharmaceutical Science of Ribeirão Preto. And my research line is about some pollutants in food samples and in the environment. And I evaluated the human exposure to these compounds through the food injection and through the bioaccessibility and bioavailable studies for the risk assessment. And today I will talk to you about the One Health and pollution, and mainly the key challenges for implementation of this approach in Brazil. Sometimes over the years, industrialization, agriculture, and animal production have increased to meet the growing demand for food. And this increase generally not is associated with providing consumers with food free from pollutants. And Brazil is the largest country in South and Central America. In the map, the Brazil is highlighted with the red color and a big country. And Brazil is a developing country with extensive continental area and large variability in climate, economy, and society across its different regions. And our country is the largest economic power in Latin America, and our economy is based on agriculture, with large exporters of soybean, chicken meat, and orange juice. In addition, Brazil is a leader in the sugarcane production, designated mainly for sugar and energy production in the country. However, due to the vast territorial extension of Brazil, there are some particularities and different concerns the economy and development of each regions. These substantial regional variations in climate, economy, development, and industrialization and lifestyle partners are influencing the distribution, the bioavailability, and the concentrations of these pollutants in different matrices, including environment, water, soil, and sediment, and foods, and human matrices too. Due to the significant growth of the agricultural sectors in the country, we observed the high pesticides consumptions. Many of these compounds, many of the use of these compounds already banned in other developed countries like Europe and the United States. And our policy is complicated because we can approve many active ingredients for use in the country. Sometimes these compounds not is produced in the country, but we buy these compounds to use it in our crops. And the concentrations found in food and in the environment many times exceeded to the threshold established for the regulatory agents around the world. One example of these compounds, of these pesticides, is the sulfuramide. Sulfuramide is a chemical widely used in Brazil as an insecticide or formicide. And its compounds is banned and not produced and used in Europe or the United States. And in Brazil, this compound is used in many kinds of crops, like citrus, like grounds, like soybean, rice, beans, and other crops. And the aerobic biotransformation of sulfuramide in soil leads to the formation of PFOS. And some studies can describe the biotransformation of sulfuramide in anaerobic biotransformation in PFOA2. This article is from other research group in Brazil, in other universities, and this article confirms the formation of PFOS from sulfuramide in Brazil agricultural soils. This article is very interesting and can inspiration my group to produce other study and developed other study with these compounds. And now our group is study the formation of PFOS from sulfuramide in citrus group, and we analyze both compounds and observe the reduction of the concentrations of the sulfuramide and increase the concentrations of PFOS in orange juice, in orange fruit too, the two products. And we analyzed and developed this method for analyzing these compounds. And I hope in some months these articles will be available to the community, to scientific community. And it's important to evaluate this study because PFOS and PFAS in general is considered a forever chemicals and is wide distribution in many environmental compartments and food samples and in the human body. This picture is very funny and terrible in the same time because we can found PFAS in the tap water, and the pessimist and the optimist has the same spread from this chemical, and the human exposure is a fact, and it's important to discuss because in Brazil this topic is very low, and the studies is very scarce. We don't have many studies or many kind of information about the levels of pesticides or PFAS or both compounds in our environmental matrices, and the evaluation of human exposure to these compounds, to Brazilian exposure to these compounds is very complicated because you don't have data about this. And I published in 4 years ago a review about the study of legacy and emerging pollutants in Latin America, a critical review of occurrence and levels in environmental and food samples. This article was published in Stoughton, and I had many citations and the distribution of this paper in other communities. And in this paper, we discuss about the levels of these compounds and the gaps in the literature found in emerging countries, in developing countries, because sometimes we don't have funding to developing this kind of studies, because this kind of studies is very expensive to developing methods, analytical methods for analyzing. The laboratory structure needs improve to analyze these different kind of compounds, study of mixture of these compounds, study of PFAS and pesticides, because pesticides is very important to our country. And this article, we discuss about the regulation, how was the regulation in our country, in emerging countries, and consider the Latin America. Brazil has the most articles and the most data, and PAHs are the major group of anthropogenic environmental pollutants studied in Brazil, and pesticides and pharmaceutical compounds are prevalent emerging pollutants found in water samples. And we are gaps in these countries about the levels of PFAS, endocrine disruptor chemicals, illicit drugs studies. And the major gaps in the literature is about the analytical instrumentation limits, because many countries don't have structure to obtain this data in environmental and food samples. The other study that I published in 3 years ago is about a review of duality and risk benefits of use of pesticides in Brazilian crops and how the legislation impact these levels and impact this use of these compounds in our country. And this review is very interesting because we discuss about the legislation and the fall legislation in our country and the use of the application of pesticides using airplanes. And this approach is very dangerous to the environment, to the community. And this approach is banned in other countries, and in our country, continue used in many crops. And our country use many compounds with very toxicity, like atrazine and 2,4-D and other compounds that have been banned in other countries because of the toxicity. And where does Brazil stand in the One Health studies? For us, it's complicated because some research in Brazil is still scarce for a single matrix and a single group of contaminants. For example, normally the studies developed in emerging countries is about one kind of matrix, environmental matrix. For example, water is the more common, and one group of compounds, for example, pesticides or bisphenols or phthalates and endocrine disruptor chemicals, for example, and in a little few samples. So implement the One Health approach is for a few research groups because there is little funding for research. Few states stand out nationally, such as São Paulo state, and the University of São Paulo is the main university of Brazil for developing researches. And studies focus, as I said, focus on a single compound or just one class of compound. Few studies involve a mixture of compounds, for example, studies with pesticides and PFAS in the same time, like sulfuramide and PFOS and PFOA. Most studies focus on a single matrix, like environment, food or animal samples, or human. And about the food, or plant-based, or animal food, or ultra-processed food, not different kind of samples for evaluated the human exposure to a better way, included the One Health approach. And few studies integrated different approaches because we don't have money to develop and obtain this data to compare it. And the most problem is the analytical capacity and our limitations, because science is expensive for developing countries, and these approaches is concentrated in some states like São Paulo. Here in the university, in the USP, we have a different kind of instrumental analysis like LC-MS, GC-MS, but is exception compared to other states and compared to other countries in Latin America, for example. And we have a solution for this. I think yes, I think we started the science and we start the developing of this data. obtain of this data, and the incentive for the international collaboration between research groups in Latin American countries and other geographical regions like Europe and the United States is very important, and would help generate more data on legacy and emerging pollutants in the region, because this collaboration is very important to both, because science not production alone. You need the collaboration to produce more data, and integrated the main kind of studies to develop the One Health approach, and improvements in the investments in research related to environmental monitoring of emerging pollutants in emerging countries, not only in Latin America, like Africa and some countries from Asia too, and to the massive agriculture and the industrialization expansion in the coming years, establishing regular monitoring programs for legacy and emerging pollutants should be on the top priority list of regulatory agencies in Brazil and in other developing countries. Because if you have a standard analytical instrument monitoring, is more easy to share this data and produce this data, because developing method to mixture or to many kind of compounds and different classes of environmental pollutants is very, very hard, and you need a specific analyst and training people in the lab to developing these methods. And if you have a regular monitoring programs for these compounds in emerging countries, is a great solution for us and for world in general. Because if you have many use of pesticides in our country for crops production, and we exported this food for other countries, the other countries also exposure to these compounds in different levels, of course, but it is a problem to other countries too. Because, for example, if you apply atrazine in our crop, and this crop go to other country that not use atrazine, the atrazine is in this other country. This is a big problem, and this monitoring, if these levels is okay in the legislation, is inside of the limits, inside of the thresholds, is below of this threshold, we don't have problem to chronic exposure in many countries. I would like to thank you for hearing me about the Brazilian research. I would like to thank you for the Research Foundation, FAPESP, in São Paulo State. My group is called Brazilian Science. We are in Instagram and in LinkedIn too. I would like to thank you for my collaborations in abroad, like UFPHA in Spain, New York State Department of Health in United States, and the University of Texas at Arlington in United States. These collaborations allows me developing my research and share my data in articles, in different platforms. And thank you so much for inviting me to this webinar.
Thank you very much, Maria. Thank you very much. You can stay for the roundtable?
Yes, I can
stay.
Okay,
very good. Then we will all together discuss everything. Thank you. Thank you very much again for a great presentation.
I had a class before, so I entered the webinar a little bit late, but
No,
I'm
no,
sorry for this, for interrupt the
it's fine.
presentation. And I will stay for the table discuss. Thank you so much, Honor, for
Excellent.
this opportunity.
Excellent. Thank you very much. I checked with Dr. Sandra Perez, and I checked her presentation. The sound is good. So probably what we have to do is maybe to. So Isabella, if you have any question
No, I don't have a question.
to
Because,
Marilia or Marilia to Isabella?
No,
no.
I'm
No.
okay.
Okay. So in that case, I think we should.
Some of the participants, no, they are too much shy.
Attendees only two left, so I guess.
We are only us, yeah. Okay.
Adam,
Is online transmission?
to ask. So Adam is a master student in Dynamed, and Fabien is a PhD student in Nice, Côte d'Azur, with Sandra.
Okay. So yeah.
Any of you have something to ask, maybe? No.
No.
Okay. So in that case, we wrap up, we close for the day, and we will start tomorrow morning again.
Thank you for inviting me.
Thank you very much,
Thank you for
Marilia and
inviting me.
Isabella, for your participation. Thanks a lot. Thank you very much.
Bye.
Sorry
Nice
for
to
this
meet you.
technical problem.
Yeah, nice meeting.
Nice to meet
Okay,
you.
thank you.
Bye
Bye-bye.
Bye.